Good morning, everyone. Thank you for being here. It's a very exciting time for progressive-minded people on Prince Edward Island, and momentum is clearly building behind the Island Green Party at the moment. And we're going to continue to work really hard over the next couple of years between now and the next election to win the respect and the trust of Islanders in order to win their votes in the next election. And building a party is a complicated thing to do. It's not an easy task, and you have to have so many things, you have to get so many things right in order to build a party which is comfortable for people to come to, that they feel will offer them a really true alternative, a viable alternative to what we have, a democratic, a progressive and inclusive, a visionary party, which is what, of course, the Green Party aspires to be. And one of the critical elements in building such a party is to have a roster of candidates who will appeal to a broad range of Islanders, who are experts in their field, who are able to speak to topics, and who can, again, win the respect and the trust of Islanders. And some of those candidates will also be shadow cabinet critics. And shadow cabinets are typically put together by conventional parties to shadow or to mirror the government departments, and that's exactly what the Island Green Party is doing. We are putting together a cabinet of people who have expertise, experience, and are well respected in their fields, and who can be the green voice, the green critics for the various government departments. But I think what will become increasingly clear to Islanders over time is, unlike the other parties, the Greens do not think about government departments in separate silos. We recognise that all things are connected, and that we need a coherent and a holistic approach to all things, whether we're talking about transportation or energy or education, or in the case that we're talking about this morning, healthcare. If we are to create lasting, proper solutions to the problems we have to look at it in a coherent, integrated manner. So, while we're here this morning to introduce Dr. Susan Hartley as the Green Party's Health and Wellness Critic, as you will hear from Susan herself in a few minutes, Greens are acutely aware that not only do we have problems, serious problems in our healthcare system, but we are also aware, we have an idea of how we need to promote a different kind of healthcare system, one which is based on proactive, preventive, health-promoting values. And the definition of health from the World Health Organization is that health is a complete state of mental, physical, and social well-being, and not just the absence of illness or infirmities. And that's the vision that the Green Party has, is of a healthy community, of all Islanders having that complete sense of health, mental, physical, and social. So I'm extremely excited and proud to introduce Dr. Hartley this morning, and I am really looking forward to working closely with Susan in the promotion of well-being and health for all Islanders. Susan.
Thank you so much, Peter, and welcome to everyone that's here. It was very exciting to me when Peter approached me, because I do share the vision that PEI can be a leader in moving forward in sustainable and innovative ways, and so if I can contribute to that, I'm very excited. Peter mentioned a little bit about my education background, but I do bring my background in clinical psychology and mental health to this portfolio. But beyond that, I bring, and I think more importantly, I bring thousands of hours of sitting with and working with and advocating for people who are seeking health and seeking help and seeking changes and positive changes in their life. So most of these people that I've worked with are facing the losses and the stressors that come with living daily life, just like all of us. But others are the most vulnerable in our healthcare system, and they have suffered terrible trauma and distress, and we need to be looking after everyone that encompasses those groups. So I've learned much from those people. I've learned about the effects of stigma on those facing mental health challenges. I've learned about the vicious circle that comes with poverty and poor health and around and around. And I've learned about the factors that support health and support resilience. So as the health and wellness critic, I'm going to challenge our system and our legislators to shift their focus for healthcare from a reactive system to a sustainable, proactive system. A system which ensures timely access to appropriate services across the province, a system which acknowledges the economic, social, and environmental factors that play a significant role in how people develop health problems, but also how those factors can come together to build healthy and resilient islanders. And also a system that develops programs to promote, protect, and proactively provide opportunities for islanders to live well throughout their lifespan. So the way I see it, there are three challenges, and the first is to effectively and efficiently care for those in our community who face physical and mental health challenges, to provide the right service by the right professional at the right time and in the right place. And the second is to ensure fair, just, ethical, and responsive systems through the establishment of advocacy roles, patient advocates, mental health advocates, child advocates, and so on. And make our programs client-centered, and evaluative, so that we evaluate the treatments and meeting the greatest needs and other quality controls measures. My focus and my passion is in building resilience. And we do that in all of those areas that Peter mentioned, not just in health. We do that in all of the departments or portfolios that are represented by our ministers. And so I look forward to working with the Shadow Cabinet and the other members of our party to build that sustainable, collective, collaborative, and complementary system to health. Thank you very much, and I'll take questions if anyone has any.